This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association, Watch Wisconsin Eye on Spectrum Channels 995 and 363, and at wisi.org.
We'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, and thanks for joining us again today. After the difficult year and the challenges we shared as a state and country, I hope everyone enjoyed the holidays and that you celebrated safely. I want to start today by thanking the healthcare workers, public health experts, and at the state and at our local and also tribal health departments, and the folks at Wisconsin Emergency Management and the National Guard for all their help as we continue working to distribute vaccine across Wisconsin. There's a long road ahead of us, but I have no doubt that we will overcome this pandemic, thanks in large part to our continued efforts together in the face of adversity. Last week, we announced the start of on-site vaccinations at skilled nursing facilities as part of the Federal Pharmacy Partnership Program for long-term care. This partnership pairs long-term care facilities with Walgreens or CVS to provide free on-site COVID-19 vaccination for residents and also staff. This will help reduce the strain on our long-term care facilities and deliver the vaccine to those in higher risk population and those who care for them. This is just another step forward in ensuring the safe and efficient distribution of the vaccine. We will continue to urge our federal partners to provide Wisconsin with our fair share and sufficient supply of vaccine while working to distribute it quickly, safely, and equitably. As I've said before, I have full confidence in our researchers, our scientists, and public health experts, and we'll get the vaccine whenever it is my turn to do so, and encourage all Wisconsinites to join me. As we welcome a new year, we also welcome a new legislative session here in Wisconsin, providing us with a new opportunity to work together to take robust and meaningful action for the people of our state. That's why yesterday I called on the legislature to pass the COVID-19 compromise bill I introduced before the end of the year as the first bill of the new legislative session. This bill addresses some of our most pressing needs to continue our state's response to the pandemic, and it was a result of several weeks of conversation with legislative leaders and includes provisions on which we could all agree. As the pandemic continues to affect our small business owners, our workers, students, and parents across the state, and every aspect of Wisconsin's daily lives, it is unacceptable that the legislature has not passed a bill to address the pandemic in now 265 days. I'm especially disappointed that yesterday Republicans decided to move forward with their own legislation instead of the compromise bill we worked on together. Wisconsinites expect and are counting on, perhaps now we're counting on them more than ever, a state government that works effectively and efficiently for them. The people of our state deserve elected officials who will put politics aside and work together to do what's best for our state. Because folks, it may be a new year, but it's the same unrelenting pandemic. Since the first of the year, 10,239 Wisconsinites have tested positive for COVID-19, and 120 individuals have passed away, bringing the state's total number of deaths due to this tragic virus to 4,979. For too many Wisconsinites, this holiday season brought new challenges like spending the season without their loved ones. Our hearts go out to all those families grappling with a loss, to those in hospital beds right now battling this virus, and the countless healthcare providers and family members supporting and caring for them. Folks, we cannot continue to stress enough the need for everybody to do their part to reduce the spread of this virus. Because in order for the vaccine to do its job in the next few months, we need to reduce the spread of COVID-19 today. We're starting to see the light at the end of the tunnel, and I know we're all anxious to get back to our Wisconsin way of life. And while the start of a new calendar year brings with it a whole assortment of fresh starts, this is one area there is no reset button. We cannot afford to lose ground in these next few months as we work to get shots in the arm and recover from this pandemic. Let's resolve to work together, wear our masks, stay home as much as possible, and continue to do everything we can to protect the health and safety of our friends, neighbors, and families in 2021. So let's resolve to get through this together. Thank you so much, and I'll now turn things over to Secretary-Designee Andrea Palm for her update. Andrea?
Thanks, Governor. Good afternoon, everybody, and thanks for joining us today. I know the holidays this year looked a little different than previous years, but I do hope that everyone was able to connect with family and friends and enjoy this holiday season safely. Even with the holidays, vaccinators across the state have been busy vaccinating healthcare workers and residents of skilled nursing facilities. At DHS, we continue to help coordinate the distribution of both the Pfizer and Moderna vaccine, and we continue to hear stories of the relief these workers and residents feel in reaction to receiving vaccine. We're still early in this process, and we will continue to improve as we go forward in our vaccination efforts. It's important to understand the magnitude of this work. Vaccinating everyone in Wisconsin who wants a vaccine is the most significant public health intervention we have ever faced, and it will take time. But we will get there. Let me reassure you, everyone who wants a COVID-19 vaccine in Wisconsin will be able to get a vaccine. It's hard to believe, but we just finished the third week of this effort, and we have many more weeks and months to go. But we are committed, and we will continue to expand and refine our efforts to best serve the people of Wisconsin. I want to take this opportunity to clarify our vaccine distribution process. Throughout the pandemic, we have been and continued to be committed to the transparency of our response. That's why we share so much data with you, including data on vaccines, and it is also why I want to give some context today for some of these numbers. The process begins when the federal government allocates vaccine to each state based on population size. We at DHS survey our vaccinators to learn their capacity for storage and vaccine administration within the next week, and then we place an order with the federal government based on those survey results. The good news is that our vaccinator capacity has grown significantly, and we continue to increase our capacity as a state. In early December, we had fewer than 50 registered vaccinators. As of yesterday, we have over 1,000 vaccine providers who are officially registered and able to administer the COVID-19 vaccine. Once we place the order with the federal government, the vaccine is shipped to Wisconsin. The Pfizer vaccine goes to regional hubs, as you all know, and then out to our vaccinators. And the Moderna vaccine is shipped directly to the vaccine location. Out of the 420,200 vaccines that Wisconsin has been allocated, 266,675 have been shipped. 106,900 have been reserved for the Federal Pharmacy Partnership for our long-term care settings, and 35,100 are second doses that are projected to arrive here in Wisconsin next week. Vaccine doses in reserve for the Federal Pharmacy Partnership Program can help explain the differences among the allocated, shipped, and administered vaccine numbers. This entire process takes time, and just like you, we want to increase our vaccinations as quickly and safely as possible. We're doing the work to get more vaccines in arms, but we also want to make sure we're doing that work well. The vaccinators have completed their safety trainings, and that we are making sure our orders match their capacity. As we continue to expand our vaccination effort, we respect the urgency of the situation and certainly appreciate your patience. In Wisconsin, 85,609 vaccines have been administered to date. As for our other numbers, we're adding 3,403 new cases of COVID-19 to our total today, which brings us to 491,341 positive cases of COVID-19 here in the state of Wisconsin. Our 7-day average of cases is 2,400. Today, we are reporting 95 additional Wisconsinites have died from COVID-19, which brings our total deaths here in the state to 4,979. Our thoughts, as always, are with the families and friends who have lost loved ones, and it just reminds us that we must rededicate ourselves to stopping the spread and preventing further loss of our neighbors, our friends, and our families. Thank you.
Thank you. And we'll now take your questions. A reminder to maintain audio quality. Please keep phones on mute until it is time to ask your question. And we'll begin this afternoon with David Wahlberg from the Wisconsin State Journal. David.
Yes, thank you very much. Secretary Palm, I'm just trying to do the math that you explained. So about 267,000 doses have been shipped, and then I think you said about 157 have been set aside for the partnership program with long-term care. So I think that leaves 110,000. What's the difference between that 110,000 and the 85,000 administered?
Mm-hmm. So 420,200 allocated to the state of Wisconsin. 266,675 have been distributed to vaccinators in Wisconsin. 106,900 are set aside in the pharmacy partnership program for long-term care. 35,100 are in our allocation, but are not expected to be delivered until next week. So that leaves just under, I think, about 12,000. But you're asking the difference between the number vaccinated and what number?
David, are you still with us?
Now I'm back. Yeah, I think I had my numbers a little bit off, but basically there's some doses available that haven't been administered yet.
Mm-hmm.
Why?
Yeah, I think there's a couple of things going on, David. I think one, we here in Wisconsin and across the nation certainly saw a slowdown in vaccination over the holiday season. I think healthcare workers across the country, like all of us, needed a little break, and so I think that there was certainly a slowdown over the holiday break as folks took a little bit of time out of the workforce, and so there were, I think, fewer vaccine clinics, fewer opportunities for some of our vaccinators to put vaccines in arms. Having said that, I think the holiday season is over, and it is now certainly time to ramp up and make sure that we are pushing that vaccine that vaccinators have through the system and into arms as quickly and as safely as possible.
Thank you, David. Now to Scott Bauer from the Associated Press. Scott?
Thanks for doing the call. Governor, as it stands now, will you veto the bill that the Republicans have introduced if it passes?
I personally haven't had a chance to see it. I've heard about it. I'm obviously disappointed that the bill that I introduced that had full support of every piece of that bill that I introduced by both the Senate and the Assembly Republican leadership. They decided to set that aside and pass things that they know that I may have trouble with. So I'll be reviewing that bill later on today, and making the decision. But it is important to remember that we had a bill that everybody had agreed on every single piece of it.
Thank you, Scott. Now to Kent Wayne-Scott from WISN TV in Milwaukee. Kent?
Hi, thank you. To follow up on Secretary Palm's remarks about ramping up the distribution, we're seeing, we're hearing frustrations, as I'm sure you are, from a lot of people about the rollout and when it might be available to the general public. We're seeing other states do things like 24/7 vaccination sites, drive-through vaccinations for first responders, penalties for providers who don't administer their doses of vaccine quickly enough. What new steps is Wisconsin taking to speed up this process?
Mm-hmm. Certainly appreciate the question, and I think it is heartening that the demand for vaccine is as strong as it is, right? Because it is the way that we end this pandemic, is having enough Wisconsinites and people across the country being willing to get vaccinated. So we are pleased at the level of interest in vaccination that we are seeing here in Wisconsin. And I think there's a couple of things going on, right? There's a need, as we have done and will continue to do, to ramp up the number of vaccinators across the state so that there is greater opportunity for vaccinators to be in local communities vaccinating. Those partnerships are longstanding with public health, right? It's local pharmacies, it's local healthcare systems, it's EMS and fire, it's other local partnerships that are the fabric, the infrastructure of how we normally distribute vaccine here in the state of Wisconsin. And those having more vaccinators in the system and enrolled will certainly help on that front, particularly some of these unaffiliated healthcare workers who are not aligned with large healthcare systems. Expanding the number of vaccinators will allow those partnerships to get at some of those folks who don't naturally have a connection to a hospital system or a healthcare system. And those are really important pieces that are falling into place. And we certainly, as I mentioned, now that we've got over 1,000 vaccinators around the state, we will see that piece of this start to ramp up. I think the other thing that we have in play is a model we learned for some degree from the testing program that we built, is an opportunity to utilize state resources to be a little bit more mobile with our vaccination clinics. Again, understanding that not all healthcare providers, not everyone in that 1A category is directly associated or have a direct link to a healthcare system or a larger entity that is doing more widespread vaccination. And so we are working to build with our local public health partners and others a version of a mobile vaccination opportunity that we will deploy here in the middle or late January that will help us, again, expand our reach, particularly for unaffiliated healthcare workers and others once we get through the 1A category, moving into 1B and other opportunities. But I think more broadly speaking, there is not enough vaccine for everybody in the 1A population now. And so again, it is really good that there is demand, and we will work through the 1A folks, those healthcare workers, as quickly and efficiently as possible. But we are going to continue to take the advice of our medical experts, whether it's at the federal level with that immunization advisory committee to CDC, or our SDMAC advisory committee here in the state of Wisconsin, to make sure that we are prioritizing this scarce resource in a way that helps us end the pandemic as quickly as possible. And so we will continue, as vaccine is manufactured and becomes more readily available, to push it through the system, to get through these priority populations in an orderly and efficient way. But for the foreseeable future, demand for vaccine is going to outstrip availability.
Ken, thank you. Now to Rachel Glass from WTMJ in Milwaukee. Rachel?
Hi, this is Mary Jo Ola in for Rachel today. Kind of just going on the vaccine subject here. First, I don't know if this would be for Secretary Palm, but seeing that about a third of the vaccines that have been shipped have been administered, do you attribute that to not enough people wanting to get vaccinated, or is that more so to the major logistics it takes to get them done? And being that there are still about 2/3 of what's been shipped yet to be waiting to be administered, is there any concern that those vaccines could go bad in a sense and no longer be viable at a certain point? Thank you.
So I think there's a lot in that question. I think one of the important things to understand is as part of the federal long-term care pharmacy program, that partnership, we have to set aside vaccine for our skilled nursing facilities and for our assisted living facilities who will come after we finish with the skilled nursing facilities. And we have set aside almost 107,000 vaccines for that program. Those are not vaccines that have, while they are in our total number of allocated vaccines, they have not been distributed in the state of Wisconsin. And so they sit in a bank. They will be given to CVS and Walgreens to be given to folks in the state of Wisconsin who reside in skilled nursing or in assisted living. But they are not in the state of Wisconsin sitting on a shelf somewhere waiting to be administered. And I think that's an important piece when you're trying to do the math on how you cascade from 420,200 down to 85,000. It's an important piece of our vaccine program. Those vulnerable populations are critical. They are in the 1A population, but it is a requirement of this program. The feds have us put them essentially in a bank, in a reserve, so that we are able to have enough sort of down payment to trigger the program and get it started. And so we are meeting those federal requirements by putting some amount in this reserve, in this bank every week. And so those are not coming to the state of Wisconsin in those distribution numbers, that 266, 675 number. They are on, that skilled nursing and assisted living bank is on top of that. And again, not sitting in the state of Wisconsin waiting on a shelf to be administered. I think to your second question, one of the things that is a requirement of vaccinators is that they have the appropriate storage and training to safely hold and maintain the viability of vaccine. And so we are not concerned that vaccine that has been distributed and is awaiting getting put in an arm is in jeopardy of going bad. Folks who have taken who have been distributed the vaccine are required to have the skills to maintain it at the appropriate temperature and store it properly and administer it safely. So that is certainly not something that we are concerned about, and it is why there is a registration process and a certification for becoming a vaccinator.
Thank you, Mary Jo. Now to Will Cushman from WisContext. Will.
Hi there. I am curious about how often you plan to share data related to the number of people who have been vaccinated. It looks like the data page was just updated today after about a week of not being updated. Do you plan to update that on a weekly basis going forward or more often? Because it seems like that might be kind of behind some of the confusion I've encountered myself and I've read about recently. Thank you.
Yeah, thanks, Will. It had been our original intention to update it weekly. I think things like our federal allocation, that number is a little bit more stable. We only hear from the feds once a week about what we can expect for the following week. But numbers like shots in arms is a number that is changing hourly, right? And so we certainly intend to pick up the cadence with which we update that number on our website. So to your point, it's more transparent. People have more real-time understanding of the number of vaccines in arms, and we are reducing the static, I guess, in the system in numbers that we display versus maybe what you see reported from other sources. We know that we have the most, through the Wisconsin Immunization Registry, we have the most accurate numbers, and so certainly intend to pick up the cadence with which we update that number.
And I just want to jump in. I know there's lots of interest in the specifics and the numbers around vaccinations and the transparency around that. But what I, as governor, I hope that interest doesn't move us away from the really important work of making sure that we don't make it worse while we're all fussing around this issue. And people still have to wear a mask. People still have to keep socially distanced. We have to do all those things. All this interest in the vaccinations, I get it. But at the end of the day, if we let our guard down because of the expectation that we're going to get a shot tomorrow and life is going to be good, we will be making a horrible, horrible mistake, because it is going to take us a long time to get these vaccines in people's arms. I know I'm towards the end of the line here, or very close to it, and I don't expect to get vaccinated until this summer. So, and I'm of a pretty big group of people, so it's all going to take time. People have to be patient, but while they're being patient, they also have to continue doing the things that they have done that make sure that we aren't continuing to infect each other while we're waiting for a shot. That seems counterintuitive to me.
Thank you, Will. Now to Sean Kirkby from Wisconsin Health News. Sean.
Hi, thanks for doing this. Could you talk a little bit more about the assisted living facility part of the long-term care vaccination program? Has that been activated yet? And when would you expect to see those vaccinations begin? Thank you.
Yeah, thanks, John. We do expect to roll it upon the conclusion of the skilled nursing facility program, which we anticipate will take through the end of January to get all those first doses in the arms of all the residents of skilled nursing here in the state of Wisconsin. The federal program, as you know, requires us to give 2 weeks notice to start the program, and as I've also talked about today, we're required to bank, to reserve vaccine in anticipation of starting that program. Our bank requirement for assisted living is about 140,000 doses, and so we want to make sure we're doing that over time and in a cadence that still allows us to have a vaccine to distribute to the rest of the state so that we can continue our vaccination efforts, both finishing skilled nursing, starting assisted living, and making sure we're getting to the healthcare workers and other folks in the 1A category.
Thank you, Sean. Now to Denise Lockwood from Racine County Eye. Denise.
Hi, thanks for taking my call. So my question is around a press release that Vanguard had issued this morning, basically saying that Racine Unified kids were being abandoned during the spring semester because the districts, actually Racine Unified District, failed to provide online education because of lack of internet access. So my question is this an accurate summation? But also, what else did you learn from that report as far as moving forward and how you're going to mitigate the impact of the COVID processes moving forward?
Excuse me, what report are you referencing?
Denise? I think she was talking about the DPI report.
This is a report from the DPI that came out.
Okay, well, I'll answer it the best I can. I understand people's frustration as it relates to how things are going educationally, but overall, in the state of Wisconsin, I think school boards have taken the right tact. They've followed science. They've followed what they believe is the right path. Most school districts have had some sort of in-person, and I see, just reading the newspapers, that many others are following suit. And so we're not in any position, I don't think any politician is in any position to stand back and say, well, any education system has failed. Those that have remained with remote learning are doing the best they can under very difficult circumstances, but I'm sure the Racine Unified School Board will continue to look at the science and see where that leads them as to what it'll look like in the future. Do I believe that there has been some learning loss any place across the state? Yes, I do. So I'm hopeful that that some of the ideas that the new president has as far as extending school year into summer or really enhancing summer school so we can have some catch up, I think that's a great idea. We'll see how that works out. Obviously, as financial issues that have to be resolved.
Thank you, Denise. Now to Katrina Nickel from Fox 11 in Green Bay. Katrina?
Hi there. So my question is, we're expecting surge after the holidays, but what is the concern when students are, either elementary or college level returning to the classroom? Obviously, we saw surges at the beginning of the school years. And is there anything that you think that we've learned from to prevent any further surges from kids returning to school?
Well, I'll just jump in and if Andrea has something to add, but we're concerned about the same things, whether we have surges or not, and that's making sure that people continue to wear masks and stay socially distanced, and those that are in person schooling must do the same. And we've also, the one thing we have learned, I'd say, through the extensive month after month of this virus is that the transmission as it relates to young children is pretty minimal as it compares to other groups. And so that's a good thing. We have had schools open throughout the surge, and they've been able to cope. So we're hopeful that that will be the case again. But schools have, any place in the state, you've seen, there are times when they've had to close down for a week or two, but I will say primarily that happens when there isn't enough teachers to teach, and it's not the kids. And so I don't see this any different than what has happened previously, and the schools that had in-person learning have navigated that pretty well.
Thank you, Katrina. Now to Bob Hague from Wisconsin Radio Network. Bob?
Hi. Hi, my question would be, I think, for Dr. Westergaard regarding the UK COVID strain, which we're told is more easily transmissible. Could you maybe explain in what way it is more easily transmissible, and should we be taking any extra precautions because of that?
Sure. Thanks for asking that question. So there have now been a number of variant strains of the SARS-CoV-2 virus, and what that means is their genetic code, when they take the virus in the lab and sequence the whole genome, has a specific number of mutations or changes. And the one that we've heard about in the UK, we first noticed because the curve was accelerating. There was more transmission in communities, and when they studied this variant of the virus, they saw in that community, and they were able to track it over time, they were able to see that any given case is more likely to lead to new cases. There's been some other research in laboratories that show that strains of the virus that have these specific changes might bind more tightly to their target in the cell or in the body. So currently, we're still learning about this. So there's a wide open area of research. But what we know so far is based on the epidemiology. When we track this virus, it does seem to spread faster in communities. So what does that mean? It means we need to work harder to prevent transmission in communities than we have in the past. The risk is that this will lead to acceleration of epidemics. But the good news is there's no new tools or no new strategy. We already know everything we need to know to slow this virus. We just need to do it more and better, frankly. So social distancing, avoiding gatherings, face masks, and hand hygiene, they work just as well to prevent when done by large numbers of people. We just have less room for error. We need to do those things with greater fidelity, with more effort, and we can't let up. So that's that's what we're learning about it. But it is the same virus. It causes the same clinical syndrome. There's currently no evidence that it makes people more sick or is higher risk once people are infected. But a large number of evidence does suggest that it spreads from person to person a little faster. So no new strategies. We just have to do what we know how to do and do it well.
Thank you, Bob. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Hi, yes, thanks for taking my question. My question is for Governor Evers. Governor, you had mentioned that you were disappointed that the Republican-led Assembly was talking about their own COVID-19 relief bill as opposed to the bill that you had proposed. My question for you is, do you feel inclined to perhaps threaten to veto the relief bill that Speaker Vos is talking about getting passed as early as this weekend? Thank you very much.
Thank you. The disappointment is absolutely around the idea that it's always good to have a bipartisan solution. We had one. We had a bill that had 20 to 25 major points that the Republican leadership had agreed to. And so why not get something done? And instead, they have decided that that bipartisan effort was not to their liking, which is an odd position to take. And so I haven't had a chance to look at the final bill, but if it involves some of the ones that I absolutely couldn't agree to, the likelihood of a veto is probably pretty strong. But I haven't seen it, so I don't want to forecast something that's not accurate.
Thank you, Rob. Now to Madeline Anderson from Fox 6 in Milwaukee. Madeline?
Hi, since my questions were already answered, I have a non-COVID related question for Governor Evers. Governor, I was just wondering if you have any comment on the charging decision that's going to come down this afternoon in the Kenosha police shooting of Jacob Blake. And I know we don't know what the decision is, but just wondering if you had any comment ahead of time. Thank you.
Yeah, and regardless of the decision, the most important thing is that we don't have a situation like this happen again. It didn't turn out well for a number of people, and that's another disappointment on my part. We had a really good bill that had lots of support from lots of people that would have dealt with the issues of accountability and transparency as it relates to policing, and had some support from different groups that care about this issue. We had a special session set, and nothing happened. So that's a dual disappointment. But at the end of the day, all of us need to find ways to make sure that something like this does not happen again.
Thank you, Madeline. Now to Heather Poltrock from WSAW-TV in Wausau. Heather.
Hi, this is Emily Davies in for Heather. I wanted to talk about vaccines and the healthcare workers that are getting it right now. So there have been a lot of different surveys, by Pew Research and others, looking at what healthcare workers are thinking ahead of this vaccine. I mean, it's brand new for all of us. There's a lot of education that goes into that. And it's kind of split three ways. Some are gung-ho to go and get it. Some need more answers. And others are, no, they're not going to get it. So are we doing enough education for our healthcare workers, especially if they're short-staffed and maybe are working and don't have time to get educated by about the vaccines? Is there any special programs to those people who are the first in line, and a lot of people look to for their opinions on whether they get vaccinated? Are they getting vaccinated enough, and what kind of efforts is the state doing with healthcare providers? Thank you.
Yeah, Emily, it's a really great question and a really important question, not just for healthcare workers, but for Wisconsinites more broadly, to your point that we look to our healthcare providers as trusted sources as it relates to healthcare choices. And so it is really important that they feel confident and comfortable and willing and interested in getting vaccinated. So I guess there are a number of things. One, there certainly is information that the manufacturers of these vaccines provide at the time of vaccination to anyone who wants to be vaccinated. And we certainly continue to do outreach with our healthcare providers, everything from the normal infrastructure that we utilize through health alert letters to webinars to other to work with our local public health departments to make sure that people have information that they need. I think more broadly, we are thinking about and working on educational materials that will be necessary for the general public more broadly, particularly when you think about populations who have been more reticent and less trusting of healthcare infrastructure over time, how we make sure that they know and understand the value of vaccination. So this will certainly be an ongoing effort, and one where we will need as a state with our partners to do a lot of work to make sure that folks feel like they have the information they need to make an informed decision. I don't know, Dr. Westergaard, if you want to say any more about that, I certainly would welcome it.
Yeah, I think healthcare organizations and clinics are doing a great deal of work to support their workforce as well, both during the registration process, the scheduling to get the vaccine, and during and after. So I think it's outreach that we can do to support people who employ healthcare providers, as well as providing education to the public and healthcare providers. I think we can feel confident that the science supports wide distribution and wide acceptance of the vaccine. Well-conducted large clinical trials have shown that highly effective and highly safe. So helping get the word out through all the channels that we can is beneficial, and we should all feel good about this as an important tool against the epidemic.
Thank you, Emily. And a reminder, we have a large list of reporters to get through, and we want to give everyone a chance. So please, just one question per reporter. And with that said, we'll go to Brittany Lewis from CBS 58 in Milwaukee. Brittany.
Good afternoon. Question is for Secretary-designate Palm. How long do you expect it will take to get through phase 1A for the vaccine?
Yeah, I think that this is it's a great question, and it's one that I wish we had a solid answer for. But some of this is dependent on our weekly allocation from the federal government, which we know almost in real time for the following week, without preview for future weeks and understanding sort of how much is coming off the manufacturing line and therefore how much is going to come to Wisconsin without a lot of notice. It's very difficult for us to figure out or calculate how long it'll take us to get through 1A. I think we estimate about 450,000 healthcare workers in the 1A category, plus our skilled nursing facility residents. So we have been sort of back of the envelope thinking it will take us several months, February kind of time frame. But again, we are all have to live within the confines of the amount of vaccine that comes into the state of Wisconsin through our allocation from the federal government.
Thank you, Brittany. Now to Taj Mahal from NBC 15 in Madison. Tajma?
Hi, thanks for taking my question. My question is about the hospital worker accused of intentionally spoiling hundreds of vaccine doses. I'm wanting to know, is the state doing anything along the lines of assisting vaccination sites or distribution locations with security, or providing any sort of security guidelines to make sure this doesn't happen again?
Yeah, obviously this is something that is now in the hands of law enforcement. But obviously, to become a vaccinator in the state of Wisconsin, there are a number of things that you need to do, including have safe storage for vaccine and folks trained in its safe administration. It is our expectation that that folks have in place the processes and the protocols to make sure that the vaccine is safe and secure, and that we are not wasting vaccine. Obviously, considering what a scarce resource it is, one of our top priorities is to reduce to as close to zero as possible vaccine wastage. I think this particular example is obviously an anomaly in that it is a person who acted in a certain way, as opposed to a process or a protocol or something that wasn't buttoned up as it relates to sort of normal course of business. So we certainly are taking this opportunity to remind vaccinators of their the expectations around the safe storage and administration of vaccine, and we'll continue to work through our normal channels with local public health and with the healthcare community to ensure that folks have the education they need in this regard. But I think this is a case that law enforcement has now taken over, and we'll see where it goes from there.
Thank you, Tajma. Now to Brittany Schmidt from WBAY TV in Green Bay. Brittany?
Hi, I have a quick two-part question. So up in Marinette County, the public health says they really haven't gotten any vaccine yet. They're going to let people know about it. So when will our public health department start playing a role in this? My second part of my question is long-term health care facilities. You know that plan has been rolled out, but what happens if those workers who are in those facilities don't want the vaccine? I know that the state said that we're not going to demand people get the vaccine if they don't want it, but are there certain circumstances where, you know, if my grandparents are in there, I'm going to want those workers vaccinated?
Yeah, so obviously the requirement for vaccination is a decision that employers in those facilities will make of their own volition. They will decide whether or not they're going to require workers in long-term care facilities to receive the vaccine. I think sort of to echo Dr. Westergaard's remarks earlier, this vaccine is highly safe and highly effective, and was tested in large clinical trials, and people should feel confident in the vaccine, and we would encourage folks to get it. You know, the governor said, I have said, when it is our turn, we will both get it. And so we would encourage folks to have confidence in the vaccine and to take it voluntarily, because you're right, we need as many folks as possible to get vaccinated if we're really going to get ourselves through this and to the other side, and reduce transmission to a point where this is no longer a pandemic. So we would encourage folks to get vaccinated.
Thank you, Brittany. Now to Danny Maxwell from WKOW TV in Madison. Danny.
Hi, I was wondering if someone could give an update on the contact tracing app, how many have downloaded, and if there are any instances of this app working, notifying someone of a close contact who was positive.
Yeah, I know that just over 1 million folks here in Wisconsin have opted in to the app, and that's great. I think I would encourage more folks to do it. It is an important tool to supplement our contact tracing work, so we're pleased that 1 million folks have joined in on that effort. But let us get back to you on some of those other details about whether it's triggered or what kind of notifications it's triggered thus far.
Thank you, Danny. Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly.
Hi. So on the vaccine, the number of vaccine doses that have been administered, I'm wondering about the 56,800 that have been set aside for nursing homes. I'm wondering if that number is included in the 266,000 that have been shipped, and how many of those doses have been administered.
Yeah. I appreciate the question, Molly, because it provides the opportunity again to sort of separate out these numbers. The 266,675 are vaccines that have been distributed to vaccinators here in the state of Wisconsin. The 56 that you note that are in the pharmacy partnership program that have gone to long-term care are a portion of what has been set aside for this long-term care partnership program more broadly. So it's those 56 plus the delta between that and 106.9 that have started to be set aside for assisted living that the federal program requires us to bank, to reserve, and they are not in that 266 number. They have not come into the state of Wisconsin through the regular method for us to distribute to vaccinators. They are in this bank. They go directly to Walgreens and CVS, who then set up the appointments and go to visit the skilled nursing and assisted living facilities to put those vaccines in arms. So that 106,960 is separate from the 266,675.
Thank you, Molly. Now to Tom Lally from WAOW-TV in Wausau. Tom.
Hi, thank you for taking my question. Looking at the number of administered vaccines per capita, Wisconsin has one of the lowest rates in the Midwest. I was wondering if you could tell me why that may be.
I think there's a number of things going on here. I think, for example, when you look at the federal system, Tiberius they call it, usually they've got about, the last time I looked, it was about 20,000 fewer vaccines administered than the Wisconsin Immunization Registry has. And so there's some about this that is moments in time, that is when the data is transferred between the states and the feds, when it's entered into the, I just think there's a lot of apples and oranges going on here. And so I think bottom line, we have administered 85,609 vaccines as of last night. We will continue to put vaccines in arms. Our vaccinator, the cadre of vaccinators here in the state of Wisconsin need to and are ramping up their vaccination efforts. It's important that we do this efficiently and safely and as quickly as we can, so that we can get to a place where we can get out the other side of this pandemic. Again, with the understanding that the rate limiting factor here is the number of vaccines allocated to the state of Wisconsin, which is determined by the number of vaccines rolling off manufacturing lines from Pfizer and Moderna. So lots of work to do here, but we are working and will continue to work with our partners to put vaccines in arms as quickly and efficiently as possible.
Thank you, Tom. Now to Maddie Heim from the Appleton Post-Crescent. Maddie?
Hi, thanks for taking this question. I'm wondering, is the state tracking the people who refuse the vaccine within this first group, or do you plan to do that at all once it's available to more broader populations?
I think we are encouraging folks to get vaccinated. It is a safe and effective vaccine. We are not tracking those who decline to take vaccine, but we do think it's important for folks to understand the efficacy and the safety and the value of this vaccine in getting us through and out the other side of this pandemic.
Thank you, Mandy. Now to Amanda Quintana from News 3 Now in Madison. Amanda?
Yes, hi. So it sounds like the vaccinator capacity is something that has really kind of put us behind. How important is that? I know you said the capacity has grown over the last few weeks, but how important is that? You know, it's hard to not compare it to other states when you think about that.